Signs of vitamin D deficiency. Vitamin D deficiency affects an estimated 1 billion individuals globally. That's a lot of individuals that are deficient in this vital vitamin. As you may be aware, a vitamin deficiency, or lack of vitamins, may have significant health repercussions if not addressed. Vitamin D is a vital nutrient that has a wide range of impacts on your body's many systems. Vitamin D, unlike other vitamins, acts as a hormone. It has a receptor on every single cell in your body. Vitamin D insufficiency symptoms in the early stages may be mild or not even present. You may feel weary and have general aches and pains, but these symptoms are easy to overlook because they can be caused by a variety of factors. In this video, we'll go over the most common signs that will let you know if you're vitamin D deficient, but before we get started, I'd like to remind you that this video is only for educational and informational purposes, and you should always consult with your doctor. Number 1. Falling sick often. One of the most essential tasks of vitamin D is to maintain your immune system firm, so you can battle disease-causing viruses and germs. It interacts directly with the cells which fight infection. Low levels of vitamin D might be an issue if you become regularly ill, especially with colds or flu. A lack of vitamin D has been linked to respiratory system infections such as colds, bronchitis, and pneumonia in several major observational studies. Taking vitamin D supplements at a dose of up to 4,000 IU per day has been shown in several trials to lower the incidence of respiratory tract infections. Only those who were significantly deficient in vitamin D had a substantial improvement after taking a high-dose supplement for a year in older research involving patients with chronic obstructive pulmonary disease, COPD. Number 2. Muscle weakness. Muscle weakness might manifest itself in the form of widespread body weariness. Muscle weakness concerns in certain spots may go undiagnosed for months if you're feeling overall weariness throughout your body. Symptoms of vitamin D insufficiency grow more severe and are difficult to ignore as the condition develops. Muscular and bone, musculoskeletal, discomfort can develop from general aches and pains, and fatigue can lead to muscle weakness. Even so, it's possible to go in the wrong way when looking for solutions. Number 3. Bone pain. In a study of individuals sent to a Minnesota clinic for persistent, general musculoskeletal pain, 93% had vitamin D levels of 20 nanograms per milliliter or less, which is deemed insufficient by most specialists. Your bones stop growing as an adult, but new bone tissue replaces the old on a regular basis. The weakening of bones known as osteomalacia, or adult rickets, which causes discomfort and promotes osteoporosis, is caused by severe vitamin D insufficiency. Vitamin D insufficiency may be caused by avoiding the sun and avoiding dairy, which can result in bone soreness. It's tough to tell the difference between this and muscle or joint pain, but it usually presents as a deep, agonizing ache that's not localized. Some indications can assist distinguish between bone and muscular pain. Muscle soreness is generally confined to a single spot and exacerbated by movement or physical activity. Bone pain, on the other hand, is more widespread and extensive. Number 4. Excessive sweating. Doctors used to ask new moms if their babies' heads sweated more than usual years ago. This might be a very early symptom of a vitamin D deficiency in a newborn. If you're nursing, it's a good idea to eat more vitamin D-rich foods, or add vitamin D drops to your routine to ensure your baby gets enough. Don't be misled into believing that a deficiency of vitamin D causes head perspiration solely in babies. If you're sweating profusely from your brow in situations where you wouldn't typically sweat, you should seek medical advice. Number 5. Depression. Vitamin D aids the production of serotonin in the brain, which influences our sense of pleasure. Low vitamin D levels have been associated with depressive episodes in studies. In one review, 65% of observational studies discovered a link between low blood levels of vitamin D and depression. However, the majority of controlled trials, which are more scientifically significant than observational research, found no relationship between the two. The experts that reviewed the papers, however, observed that vitamin D doses in controlled studies were frequently quite low. Furthermore, they noted that some of the trials may not have been long enough to assess the effect of supplements on mood. Giving vitamin D to deficient persons has been proven in certain trials to aid with depression, especially seasonal depression, which occurs during the winter months. Number 6. Cardiovascular disease. Cardiovascular illnesses are cardiac disorders that include, among other things, damaged blood arteries and frequent blood clots. Vitamin D deficiency has been linked to congestive heart failure, according to research published by the National Institutes of Health. Dizziness, heavy bloating, especially in the legs, breathing problems, and chest discomfort are some of the most visible cardiovascular disease symptoms. If you see any of these signs or symptoms, you should see your doctor right once. Home tests for vitamin D deficiency are available if you want to double-check that you're on the correct track. These tests will examine your blood and may indicate whether or not you need to alter your supplements regimen. Number 7. Chronic pain. A deficiency of vitamin D may be contributing to chronic, widespread soreness throughout your body. This link was uncovered only lately. Low vitamin D levels have now been found to raise the risk of chronic pain, and supplements can occasionally help reduce it. So, if you're suffering from soreness, consult your doctor about the best approach to increase your vitamin D consumption. If you wish to try a preliminary test to see if what you're feeling is the same as chronic pain, physicians prescribe the following. Press your palms against your breastbone, which is located in the center of your chest, also called your sternum. If pressing down on that region causes sharp pain, you're probably suffering from chronic soreness caused by a vitamin D deficiency. Number 8. Slow healing wounds. Slow healing of wounds following the operation or injuries may be an indication that your level of vitamin D is too low. According to the findings of a test tube study, the vitamin boosts the synthesis of chemicals that are essential for the formation of new skin during the wound healing process. Vitamin D insufficiency hampered several elements of recovery in patients who underwent oral surgery, according to an analysis of 4 research. Vitamin D's involvement in regulating inflammation and combating infection has also been considered to be crucial for healthy healing. Patients with diabetic foot infections were the focus of one study. It was shown that those with severe vitamin D deficiency had greater levels of inflammatory markers, which can impede recovery. Sadly, there is currently very little data on the benefits of vitamin D supplementation on wound healing in patients with a deficit. However, in 12-week research involving 60 persons with diabetic foot ulcers, taking a vitamin D supplement dramatically enhanced lesion healing compared to a control group. Number 9. Hypertension. Vitamin D insufficiency was linked to an elevated risk of many health outcomes, including cardiovascular disease and hypertension, abnormally high blood pressure, according to an analysis of health research done by Harvard University across multiple cohorts. Another research published in the journal Circulation in 2015 looked into the efficacy of vitamin D supplementation as a therapy for hypertension and pre-hypertension patients. It's vital to remember that high blood pressure raises your chance of major health problems, including heart attacks and strokes. But don't be alarmed if you suspect or know you have hypertension. It's a prevalent health problem that affects over 3 million Americans each year. It can be detected without the use of blood or medical testing, but an official diagnosis from your doctor is required before therapy can be provided. Number 10. Hair loss. Stress is often blamed for hair loss, and it is indeed a prevalent culprit. Severe hair loss, on the other hand, might be the consequence of an illness or vitamin deficiency. Low vitamin D levels have been related to hair loss in women, however, there has been little study on the subject so far. Low vitamin D levels, in particular, have been related to alopecia areata and may be a risk factor for getting the illness, according to studies. Alopecia areata is an autoimmune illness that causes significant hair loss on the head and other body regions. It's linked to rickets, a condition that produces fragile bones in youngsters owing to a lack of vitamin D. Lower vitamin D blood levels were linked to more severe hair loss in patients with alopecia areata, according to one study. In another research, a synthetic version of the vitamin was found to dramatically enhance hair regeneration in a group of patients with alopecia areata when applied topically for 12 weeks. Number 11. Crankiness. Vitamin D impacts the amounts of serotonin in your brain, which affects your mood, as we discussed in connection to depression. It's possible that you're irritable because you're not creating enough serotonin. Vitamin D keeps your moods in check by ensuring that your brain has the resources it requires to be energetic and focused. Visit your doctor for a simple blood test if you observe mood fluctuations that appear unusual. They'll be able to figure out what's wrong, and if it's a vitamin D deficiency, they'll work with you to develop a treatment plan. The answer might be as easy as spending more time in the sun or eating vitamin D-rich foods. Supplements are easily accessible for those who can't tolerate too much direct sun exposure, so grab for some before going off on anyone or becoming too upset with yourself. Number 12. Erectile dysfunction. Alcohol, smoking, high blood pressure, and diabetes are just a few of the variables that can cause erectile dysfunction, ED. However, according to a 2015 study by Johns Hopkins University, vitamin D might also be a direct factor. Vitamin D deficiency was observed to increase the risk of ED by 32% in males compared to those with normal vitamin D levels. Number 13. Frequent urinary tract infections. A urinary tract infection, UTI, is the last thing anyone wants to deal with. You're probably aware that germs entering the urinary system and proliferating cause the problem. But did you know that a deficiency in vitamin D might also be the cause of the infection? Researchers discovered that recurrent UTIs in women were linked to a vitamin D deficit in a 2013 study published in the International Journal of Infectious Diseases. Number 14. Digestive problems. When you have inflammatory bowel disease, IBD, your digestive system is inflamed on a regular basis, resulting in diarrhea, stomach pain, and tiredness. And it turns out that getting enough vitamin D might reduce your chances of having to deal with such a tough illness. That's because, according to a 2013 study published in the journal Alimentary Pharmacology and Therapeutics, vitamin D deficiency may not only raise your chance of getting IBD, but also have a role in the severity of the disease. Number 15. Overweight. Get your vitamin D levels evaluated if you're overweight. Obese people are 35% more likely than non-obese people to be deficient in vitamin D, according to a 2015 study published in the journal Obesity Reviews. These are some signs to check for to see if you have a vitamin D deficit or not. These indicators aren't always obvious at first, and they might be tough to see. To boost your vitamin D levels, start by eating more vitamin D-rich foods and increasing your sun exposure. Vitamin D insufficiency is easy to correct, and once levels are restored, it can help with a variety of health issues. I hope you enjoyed the video, and if you'd want to help us produce more like it, please subscribe to the channel and turn on the bell to get any future videos with more useful health-related tips and information.